Hello students, my name is Rajgun Hendik, Assistant Professor, Department of Humanities and Social Sciences, Assam Downtown University. Today I am here to discuss with you all about mental health. So, what is mental health? Mental health describes a level of psychological well-being or an absence of an mental disorder. The World Health Organization defines mental health as a state of well-being in which the individual realizes his or her own abilities, can cope with normal stress of life, can work productively and fruitfully, and is able to make a contribution to his or her community. So, there are different types of mental health problems, some of which are common, such as depression and anxiety disorders, and some not so common, such as schizophrenia and bipolar disorder. Most recently, the field of global mental health has emerged, which has been defined as the area of study, research, and practice that places a priority on improving mental health and achieving equity in mental health for all people worldwide. So next we will be discussing about the significance of mental health. Evidence from the World Health Organization suggests that nearly half the world population are affected by mental illness with an impact on their self-esteem, relationships, and ability to function in everyday life. An individual's emotional health can also impact physical health, and poor mental health can lead to problems such as substance abuse. The importance of maintaining good mental health is crucial to living a long and a healthy life. Good mental health can enhance one's life, while poor mental health can prevent someone from living a normal life. The importance of maintaining good mental health is crucial to living a long and a healthy life. Good mental health can enhance one's life, while poor mental health can prevent someone from living a normal life. So, mental illness as a stigma. So, it has been seen in the present scenario is that the mental illness is considered as a stigma. So, stigma is defined as a sign of disgrace or discredit which sets a person apart from others. The stigma of mental health, although more often related to the context than to a person's appearance, remains a powerful negative attribute in all social relations. Mental illness, despite centuries of learning and a decade of the brain, is still perceived as an indulgence, a sign of weakness. Self-stigmatization has been described, and there are numerous personal accounts of psychiatric illness where shame overrides even the most extreme of the symptoms. So now in this we'll be discussing about the contributing factors to the mental health. Number one, first, that is the social and environmental causes. This might be things such as where we live, our place of work, whether we have close friends and family, how and where we can relax. Where we live, the physical environment where we live can be very stressful, particularly when there are problems with neighbors or if there are high crime rates and other such issues. Next is where we work, whether we enjoy our work or feel that we are under too much pressure, are unable or we are unable to find employment or hold down a job, can all put pressure on our mental well-being. Families and friends, When we face difficult time, our support networks become very important. Those who do not have close friends or families, or those who do not live near the people who support them, may find it increasingly difficult to cope alone, and this may result to the deteriorating mental health. How and when to relax? All these kinds of problem will increase the amount of stress people undergo and can cause depression and anxiety, especially in situations where people do not have a time or a place to relax. Some of the psychological signs and symptoms of deteriorating mental health are feeling sad or down, confused thinking, excessive fears or worries, withdrawal from friends and activities, problems in sleeping, detachment from reality, which, for example, delusion or hallucinations, inability to cope with daily problem or stress, alcohol or drug abuse, significant changes in eating habits, sex drive changes, excessive anger, hostility or violence, suicidal thinking. So these are some of the psychological symptoms of deteriorating mental health. Next, we will be discussing about the physical signs and symptoms of deteriorating mental health. First we have is fatigue, then back pain, chest pain, digestive problems, dry mouth, headache, sweating, weight gain or loss, rapid heart rate, dizziness, etc. Now we will be discussing about the treatment aspects of mental illness. So in the treatment of the mental illness, the first that follows is the initial assessment. In the initial assessment, the case history of the patient and the families are taken. Then comes the role of psychiatrists and the general practitioners, which is available throughout both public and private healthcare. The psychological treatment includes treatment methods like cognitive behavior therapy, interpersonal psychotherapy, dialectical behavior therapy. Then we have treatment with medication and other form of treatment. Treatment with medication. Medications are mainly helpful for people who are more seriously affected by mental illness. Different types of medication treat different types of mental illness. Some of the medication used are antidepressant medications. About 60 to 70% of the people with depression respond to the initial antidepressant treatment. These medications are now also used in combination with the psychological therapies to treat phobias, panic disorders, obsessive compulsive disorders, and eating disorders. Next we have is antipsychotic medication. These medications are used to treat psychotic illness, for example, schizophrenia and bipolar disorder. Newer antipsychotic medications may have some side effects but tends to have fewer of the effects that were associated with the older medication. For example, stiffening and weakening of muscles and muscle spasm. Then we have then the other type of medication we have is mood stabilizing medications. These medications are helpful for people who have bipolar disorder. These medications such as lithium carbonate can help reduce the reoccurrence of major depression and can help reduce the manic or the high episodes. Next, we have the other forms of treatment methods. Effective treatment involves more than medication. Treatments may also involve community support, electroconvulsive therapy. So community supports includes information, accommodation, help with finding suitable work, training and education, psychosocial rehabilitation, and mutual support groups. Understanding and acceptance by the community is very important in order to treat the patient who is suffering from mental illness. Then the other form of treatment method is electroconvulsive therapy. This treatment can be a highly effective treatment for severe depression and sometimes for other diagnoses when other treatments have not been effective. After the person is given a general anesthesia and muscle relaxant, and electrical current is passed through the brain through their brain in this form of treatment. So in conclusion, I would like to say that it is a high time that we give importance to mental health and try to remove the stigma that is attached with mental illness. So with this, I have come to an end to my presentation. Thank you for listening.